My name is Steve Warren from Skill Care Corporation. In this video, I'd like to demonstrate the proper application and use of the super soft heel protector. The purpose of the heel protector is to prevent heel ulcers by offloading the heel pressure and distributing the forces to the lower part of the calf, which can handle the pressure more readily. At this point, I like to cite some cautions. The first caution, number one, would be use this product only on bedridden patients. Number two, don't allow the resident to walk on the floor while wearing this heel boot. Number three, make sure that the product is placed with the toe label up in the upper area. And remember, black is placed on the bottom or bed. So just remember, B to B, black, bed, or the bottom. And this is the toe label that we're looking at, and this is the upper portion. Number four, have a medical professional remove the heel protector periodically to inspect the skin. Number five, do not over-tighten the straps. Number six, assure that the foot is placed in the protector so that the heel is offloaded. And what we mean by offload is the heel is not touching the bed or the surface that the heel is resting on. Number seven, when used with a deep vein thrombosis, sometimes called the DVT device, assure that the tubing isn't in contact with the skin or airflow isn't compromised. Number eight, if necessary, launder this heel boot at temperatures below 180 degrees Fahrenheit, which converts to approximately 82 degrees centigrade. Also, dry this at the low setting and don't put bleach on it directly. It's also beneficial to connect the straps and close them before you launder this. It handles the forces mechanically a lot more effectively. This is a universally sized product, and it also could be used on either the right or left foot. If the medical care professional feels that the size is not appropriate, then don't use it on the resident. There are alternative products that are sized from petite to bariatric. Prior to demonstrating this product, I'd just like to talk about some physical characteristics. Firstly, this is an inside cozy cloth, low friction surface. So it's very smooth and it doesn't build up heat, it doesn't build up shear forces. We have two straps, and it's important when this strap is applied that it's the soft surface facing the skin, and when it goes through the loop, I'll just demonstrate the loop. Goes in here. This is a Velcro hook material, and so I call a back strap. This can be adjusted to any length. The outside surface is a wipe clean nylon, and you can use PDI wipes or any antibacterial cleaning agent. And I just like to make one other point, is that although there are two straps on this device, it's up to the the medical professional to determine whether one or two straps are used. It's not necessary to use both straps. In many situations, you want to keep the resident's leg in a neutral position. And what I mean by that is not to have external or internal rotation. So Skill Care developed an anti-rotation wedge, as you can see, and this foam has Velcro on the bottom. The boot has a loop material that's compatible with this. So essentially, you're taking the resident, putting their leg in the device, and again, toes are up, and inserting the boot in here and making sure that it's vertical, pressing it down a little bit so that the two sections of Velcro mate. And in this case, we've stabilized the leg. And you can see how it prevents internal and external rotation. This device can be used on either one leg or two legs simultaneously. What I'd like to do now is demonstrate the proper use of this heel boot. Again, toe label is up. And in this case, this is the designated leg. And very important to make sure that the heel is all the way to the back. So what I would do is I'd pull this surface snugly to make sure that the heel is offloaded. We then have these two straps. And I know you can't see in the video, but there's a loop on the opposite end. And I'm backing up on the strap. Strap number one. Strap number two. And as I said previously, it's up to the medical professional to determine whether you want to use one or two straps. And also, very important, make the straps snug but not too tight. And by using the patient feedback, you can determine whether it's too tight or not.